So we've got a question here for Shanti, and if that possibly it could also be relevant for Andrew, I think, as well. How are you managing to interact with elderly patients who don't have access to digital tools? So I can see that it's obviously a bit of a, you obviously try to improve social access, but there could be downsides there as well, or difficulties.
That, you know, we are very aware of these issues, and we've got various groups at Barts Health that are looking at equity and access. And one of the ideas at the moment is to have volunteers in the community to work with people who are struggling to access. So the idea is that for people who aren't confident, that they can receive a phone call prior to their video appointment to talk them through how to access it. But we're aware also, you know, there's other things that we need to do for people that haven't even got the equipment and things like that. And it's very much about working with the community, because there's a lot going on in the community about digital access in general. I think there's some repurposing of equipment going on as well, and different initiatives that are taking place that we're trying to link up with.
The other thing I would just say from personal experience, so I think making preconceived judgments about how people access is probably not appropriate, as I've discovered. So I often look at older people and think they probably won't accept it. But actually, a lot of people, especially post-COVID, have been so used to keeping in touch with family and friends around the world that they've started using Skype and online technology and Zoom and all sorts of things. And where it does help is you often have to have carers taking time off work and accompanying older people for hospital appointments. And I've often found offering people a choice. Obviously, one size will not fit all, but very often a carer or a son or somebody has been quite happy to log someone into an online consultation and then sit with them, maybe log them off, and then and that way it seems to work better. They don't have to make a journey, especially a lot of my patients are shielding at the moment, and they don't really want to use public transport and make a journey into hospital. And people just find it financially viable for carers to help assist family members to do online contact, which we're finding a lot of over the last few months.
Great, thank you so much. That's really great. And what about from a primary care perspective, Andrew? What are you finding?
Yeah, well, this was one thing we were very aware of when we implemented the system, and that we were aware that not everyone would be able to use it. So we were very careful in the protocols we put in for our receptionists that, you know, when we were encouraging online consultation use, we were, you know, checking with them if they felt they could use it and make it clear if they could phone back if they're having problems. Another thing we did was that we purchased an iPad, and we had one of our receptionists for a few weeks in the waiting room actually trying to show people how to use it and show people how easy it was to use as well, to try and provide some education